Your child keeps saying the stomach hurts, but everything else seems normal. So what's really going on? As a pediatrician, one of the common causes of abdominal pain is something parents aren't even thinking about. And you might be surprised when I tell you what it is. I'm Dr. Obedi, I'm a pediatrician, and I've been practicing in the Hagerstown area for over 22 years. And we're going to talk about that one of the most common causes of abdominal pain, which is constipation. Now wait, before you tune me out and say this cannot be your child because they go every day, listen to this statistic. 3 out of 10 children suffers from constipation. That's a lot of kids. 30% of kids suffer from constipation. And if you take school-age kids who are complaining of abdominal pain, almost half of them will actually have constipation as a cause. The actual statistic is 48%. 48% of school-age kids will have constipation as a cause of their abdominal pain, either acute, so which means it just started, think days or weeks, or chronic, which means it's been going on for a while, think months or even years. And I can tell you, I see this every single week in my practice. Lots of kids come in with abdominal pain, and when I dig in a little further, we find out that they've had constipation for quite a while and the parents were not aware of it. So this is a really important video for you to listen to because it might open your eyes to some of the reasons why your child might be complaining of abdominal pain. Now, why is constipation important? It is important because it affects kids significantly. A good number of kids will have abdominal pain when they have constipation, which can be really very uncomfortable. So much so, a lot of them are actually going to miss school days because of how much pain they're in. Some of this pain may come just from the body trying to get rid of the hard stool, and some of it may come from anal fissures, which are tears in your child's butt area. And those are very painful. Constipation also causes stool withholding, which is where your child doesn't want to go and they don't want to poop because it causes so much pain. And so, of course, when they hold it in there, it makes matters worse because your stool only gets harder and more difficult to get rid of. It can also cause more doctor visits than are necessary, trying to figure out what's going on with your child and this abdominal pain that does not go away. Now, what is constipation? How do you recognize if your child is constipated? We're going to keep it simple here. If your child is moving the bowels 2 or less times a week, they're most likely constipated. A child really should go about every day or every other day. So if you're skipping 2 or more days a week without having a bowel movement, chances are they may be dealing with constipation. You can also have large stools. The stools could also be hard, and you may also have loss of straining. So if you have one or more of these going on, chances are your child might be dealing with constipation. Now let's talk about what constipation looks like. I'm not going to talk about what constipation looks like in infants. I actually did another video in that age group because it does look different in babies. I'm going to link in the description that video so you can go watch it. For toddlers and children, this is what constipation will look like. Abdominal pain, hard stools, and refusing to eat. And the reason they're oftentimes refusing to eat is because they experience abdominal pain every time they eat. And that's because of something called the gastrocolic reflex. And the gastrocolic reflex is just a normal physiologic reflex, so just a normal way your body functions, which is when the stomach stretches, it sends signals to your colon, that's your large intestine, to get rid of any stool there because it's getting ready to receive the food that is coming down the pike. And so when kids eat, that reflex kicks in because the colon is contracting against hard stool, trying to get rid of it. It's painful. And so kids start to associate eating with abdominal pain and tend to want to not eat anymore. So if a kid is complaining of abdominal pain and refusing to eat, there might be some constipation going on. Ask them about their stools and what that looks like. Or more importantly, see what a stool looks like. Now, what does constipation look like in older children? It's going to look like abdominal pain, large stools, clogged toilets, and just a decreased appetite. which can come from just feeling full in general or also the gastrocolic reflex. Now, this age is very tricky because older kids in general don't like to talk about their bodies and what's going on. They're just trying to figure out this growing thing and the way their bodies are changing, and they just feel it's all weird to talk about things like poop and all the other things that are going on with their bodies. They're very self-conscious. You might have to do some digging in here when they start to complain of abdominal pain or just not interested in eating as much. Try and tease out if there's a lot of discomfort when they're eating, and try and start to ask about their stools. If they don't want to talk about it, tell them not to flush after they've gone so you can look at it. You're going to have to work hard here because lots of older kids really don't want to talk about their stools, but it's really important to find out what's going on because at this age, they're taking care of themselves, and so you oftentimes may not realize that they're struggling with constipation. You see them go to use the toilet or use the bathroom every day. Half the time they may be in there using their phones and not really going or just struggling to go. And for a lot of kids, this becomes just normal for them, especially when constipation has been going on for months and years. They're just used to it. This is just the way they go. And so they don't really realize that it's constipation. It's just part of their routine. Now, there are 3 critical periods of transition when you might have constipation developing in your child. One of them is actually in infancy. So this is about 4 to 6 months of age when you're introducing solids. If you don't start to add water to their diet at that time, you might have constipation developing. For toddlers, this is around potty training. Now, this is a time when they're trying to figure out using the toilet. So they may have a potty that they use. It's a very weird thing that's either sitting on the floor there that they're supposed to sit on and poop in, or little porcelain thing in a little small scary room, and that makes this weird flushing sound that's very loud and annoying. So there's just so much going on with trying to potty train that sometimes you just have a child who starts to withhold their stool because they don't want to go through the experience. So that's another critical transition period that constipation may occur. Another critical period where this may happen is school entry. So right around 5 to 6 years of age, when they go into kindergarten or first grade, because this again is another period where now they have to use this toilet in a very public place where the toilet flushes even louder and makes lots of noise. You'll be surprised how many children are actually very sensitive to loud noises, and so it's just very uncomfortable. What ends up happening is kids start to withhold their stools again. They don't want to go in the toilet during the school day in this very public toilet, and so they'll hold it and try and do it later on when they get home. That stool starts to get harder the longer it sits in there and difficult to get rid of. Transition periods are very critical to think about because that's where constipation could occur, and you want to be extra vigilant and make sure you're doing everything you can to try and prevent it from happening. So what do we do about constipation? Well, this is where the saying, an ounce of prevention is better than a pound of cure, becomes really important because you really want to try and prevent this. Because when it starts to happen in children, it can be quite difficult to take care of because this behavior gets reinforced and really established and ingrained and takes a while to really walk through getting the child more regular again. Big picture, what you need to do is more fluids and more fiber. But we're going to walk through what this looks like in the various age groups. For toddlers and young children, it's really important that you start fruits and veggies early. You want to get them enjoying fruits and veggies at a very young age, and this really takes a lot of working at. You have to be very intentional because lots of kids don't necessarily gravitate to fruits and veggies naturally, especially if you do not introduce them early. In those infant years, when you're introducing foods, and certainly in the toddler years, you want to be giving them lots of fruits, lots of veggies, trying different vegetables and different ways you cook them just to get them used to it. They may not eat a lot right away, but don't stop. Be persistent. Introduce it often and in different ways. Encourage them to take little bites and just to get used to it, because if you can get lots of fruits and veggies in earlier on and stick to it, it can go a long way to preventing constipation from developing. The other thing you want to do is to really be very intentional about potty training, taking your time to do it, making sure your child is ready for it, starting very early to go through the process. So this could be somewhere between 2 to 3 years of age, starting to read about potty training, maybe watching some videos about potty training, having a potty available that they can start to get used to, maybe watching you use the toilet so they can get used to this being a natural process that happens. Now, of course, it's important that you do not force your child to potty train, because that becomes an issue where it becomes a power tussle and can actually be counterproductive to getting them to potty train. The other thing you want to do when you're potty training is make sure that there's good positioning. If they're hanging onto the edge of the toilet and their legs are dangling, it's difficult to really have gravity help in the process. So what you want to do, either you're using a potty on the floor where your child can sit on it with their legs on the floor, or if you're using a toilet with a toilet training seat on top of it, that you're using a stool. Put your legs on the stool and feel grounded when they're using the toilet. Really very key. A few other things you can do during this period to help with the process of preventing constipation is to make sure that potty training is a very unhurried time. The best time to have your child try and go and empty their bowels is after a meal. We talked about the gastrocolic reflex earlier on, where when the stomach stretches, it sends signals to the large intestine to contract to get rid of the stool in there. And so if your child finishes a meal and sits on a toilet, that reflex is going to be working in their favor, because they just ate, the stomach just expanded, the large intestines of the colon is already contracting to get rid of the stool. And so if they're sitting down there, it's easier for them to go during those periods. It's also important that you do not introduce screens during a child's potty time. And the reason is you want your child to learn how to understand what's going on with their body. There's a lot of signals going on when your child sits down to potty train. All this really involves them having to make this mind-body connection to understand what's really going on and have that process move smoothly. When your child is watching a screen or reading a book, when they're trying to have a bowel movement, it's difficult for them to pay attention to those cues that are going on in the body. So that's something else that can stand in the way of them moving their bowels more efficiently. Now, in your older child or teenager, prevention looks more like proper nutrition and hydration, drinking lots of water, and we're going to talk about quantities very soon, but also good nutrition, making sure that they're eating lots of fruits and veggies, lots of fiber in there. That goes a long way. You want to make sure that they have a regular time that they go to the bathroom to try and have a bowel movement. So that could be in the morning when they're getting ready for school, or in the afternoon when they get back from school, or in the evenings. You want to try and get them to develop a habit, and that can make it easier for them not to withhold the stool in there where it becomes harder and more difficult to get rid of. You also want to make sure that if they start to complain about abdominal pain, that you ask them about their bowel movements and what that looks like, and make sure that they're not beginning to have hard stools or really large stools, which could signal that constipation is beginning to set in. I also want to encourage you at this age to really make discussing health a normal, natural process. Ask them about how things are going with their health, if they have any concerns or any questions, so that talking about their health is a natural process. So when things like constipation start to set in, that they are not resistant to bringing this up with you. Now, how much water should your child be drinking? Let's talk about that very briefly. I'm going to give just some reference quantities of water based on how much your child weighs. You just want to get to as close to those amounts as possible. If you exceed them a little bit, even better. So let's get into it. For a 22-pound child, you want them to drink about 32 ounces of water a day. For a 33-pound child, that reference range is about 42 ounces of water a day. For a 44-pound child, that should be about 50 ounces of water a day. And for a teenager or an adult, you should be giving them about 64 ounces of water a day. That's roughly about 4 of these regular water bottles a day. Now, I don't know about you, but it can be quite difficult to get enough water in every day. I am more likely to reach for my cup of coffee than for my bottle of water. And so you can certainly understand when our children struggle to drink water, and it's going to involve encouraging them to drink more, setting good examples, setting reminders, and trying to make sure that they're drinking enough water in the course of the day. So think about getting a nice water bottle that your child likes, setting a timer, maybe if it's really difficult, so that whenever it goes off every hour or every other hour, that you're reminding your child to drink out of their water bottle. It's certainly going to be just making it available. A key is also just not bringing in too many other beverages into the house, because if you have lots of soda and juices at home, your child and yourself are more likely to drink that as a beverage, as opposed to if there's very little of that, and so the only other option is just water or maybe some plain milk. Now, the other big part to talk about is fiber. We all should be getting more fiber in our diets. How much fiber should your child be consuming? Here's a very simple formula you can use. Take your child's age and add 5 to 10 grams to that age, and that gives you roughly about how much fiber they should consume a day. So if you take a toddler who is about 2 to 5 years of age, that will look like 7 to 15 grams of fiber a day. And for teens and adults, it comes out to about 25 to 30 grams a day. So get into the habit of looking at the fiber content of your kids' meals so that you can figure out if they're getting enough fiber in the course of a day. Great examples of fiber in our foods include oatmeal, sweet potatoes, whole wheat bread, apples, berries of all kinds. All these have great fiber content. And of course, you can certainly Google this and figure out what are the foods with great fiber content you can add to your child's diet. So what do you do if your child has constipation? Now, if your child has mild or recent constipation, here are a few simple things you can do at home. Increase the amount of water and the amount of fiber in the diet. We just went through that earlier on in this video. So go reference that again and see if your child is getting enough water and enough fiber, because sometimes that's all you need to do to resolve the issue. You could also use fiber supplements, but if you're going to do that, make sure you're using the right dosage recommended for your child's weight or age. And also make sure that they are drinking enough water to make sure that the fiber supplements work the way they're supposed to. You may also have to use an osmotic laxative, something like Miralax, which is a very common brand name. But if you're going to do this, I want you to make sure that you're getting some guidance from your pediatrician so you can make sure you're using the right quantities. If your child has severe or significant constipation, I really want you to consult your pediatrician. If you're a patient at our practice, go ahead and call the office at 301-791-7060 and make an appointment so they can get a proper history, figure out what's going on, and come up with a game plan to take care of the constipation. Now, it's really important as we wrap up this video that we talk about red flags you don't want to miss. So these are really important signs and symptoms that if they're happening, you seek medical attention right away. So it's going to be things like if your child has a fever with the constipation, vomiting, rectal bleeding, if they are stool withholding, so they're just refusing to go, and this is going on and on. If it's chronic, so it's been going on for months, maybe even years, this is something you want to bring to your pediatrician's attention. You want to seek medical attention right away. You don't want to handle this on your own at home. So, in summary, constipation in children is really important because it does affect a lot of our kids. Remember, almost half of kids, 48% of school-age kids who are complaining of abdominal pain usually have constipation going on and has been going on usually for quite some time. And so it's really important that we address this right away. Remember that prevention is better than cure. It's really important that we try and prevent this from happening. And if it does happen, that we're treating this very early, because it can be quite challenging to take care of constipation if it's been going on for a really long time. I want you to also be patient with yourself and with your child. Make sure that you're not giving up. Make sure you're seeking help. If you need some help addressing your child's constipation, call the office at 301-791-7060, and one of the providers will be happy to sit down with you so we can come up with a plan to help your child move their bowels more easily. All right, till next time, thank you for watching.